Treatment of myeloproliferative diseases with JAK2 inhibitors is now standard of care, and we looked at it from a different perspective because we noted that there were some published cases of lymphomas arising in patients with myelofibrosis who received treatment with ruxolitinib. We had 4 cases in Vienna, and that's why we started to study the frequency of these aggressive B-cell lymphomas in patients who received treatment with JAK2 inhibitors. The data we found was that approximately 5% of patients who received this treatment developed aggressive B-cell lymphomas, and that was validated in a cohort in Paris, Jean-Jacques Kilagian's patients who found 3.5%. That's an increase in risk by about 15 to 16. When we analyzed these patients, we saw that they all had aggressive B-cell lymphomas, that these B-cell lymphomas had a high MYC expression, and we also noted that the majority of the patients had the lymphoma in the bone marrow, which is quite unusual. And that's why we went back to the bone marrows that we had collected during the myeloproliferative phase in these patients, and we could detect a small B-cell clone before they developed the lymphoma, and that was between 47 and 70 months before the development of lymphoma. We sequenced the clones in 2 of these patients, and the clones were identical with the ones that later were found in the lymphoma. So it seems that there is a pre-existing B-cell clone that then comes up when the patient is treated against the myeloproliferative disease. We have also a nice collaboration with the Veterinary University in Vienna. They developed a mouse model for the disease that also showed very similar results. Now, when we went back to patients with myelofibrosis, we saw that in fact 16% of all patients who have a myelofibrosis also have these B-cell clones in their bone marrow, but only the ones who received the treatment with the JAK2 inhibitors later developed the lymphoma. So we think that the pre-existing B-cell clone could be a selection criterion for patients who will later receive this JAK2 inhibitor treatment. And for instance, if somebody doesn't have the clone, he would not be at risk to develop lymphoma. If yes, then watch out and take special care of this patient. And we, of course, hope now to validate that in a larger cohort of patients.